Start recording.
Right, shall we admit?
Hello.
No.
Hello, welcome everybody. Welcome to the first International General Practitioner Recruitment Programme broadcast called Being a GP in the NHS. I hope that you're enjoying listening to us. You're all around, and we're just going to pause just a second for a few more people to join us. We're going to start with some introductions. So I don't know if any of you have heard of the campaign called Hello, My Name Is. Dr. Kate Granger, who was a medical consultant, unfortunately died about 1.5 years ago now, and she actually talked a lot about her journey and her experiences of being a doctor and a patient. She died of a very rare form of sarcoma, and I would really jot down, if you've got a piece of paper now, jot down Dr. Kate Granger and have a Google of her, and also look up Hello, My Name Is. It's a hashtag. She noticed that unfortunately, when she was in hospital, the only person who introduced himself to her was the porter who was wheeling her to X-ray, nobody else. And so she started a campaign called Hello, My Name Is, to encourage all healthcare professionals to introduce themselves to each other when they first meet a patient. So you'll notice that hashtag and that logo around a lot of hospitals, a lot of GP practices, to remind us all as healthcare professionals to introduce ourselves to patients. So we're going to start by using that today. So hello, my name's Kim. I'm a nurse by profession and was an intensive care nurse for quite a while, and worked at Kingston University as a nurse teacher, and now work both for the General Medical Council and also for NHS England on the International GP Recruitment Programme. And the reason that I love working on this programme really is that I feel passionately about the support that's needed and the support that we should give doctors, not just GPs actually, but all doctors coming to the UK. So that's certainly why I'm interested in the international GP recruitment process. And I know, Mehreen, you're going to talk a little bit about your background to sort of illustrate what it is to be a GP in the UK.
Thank you, Kim. So hello, my name is Dr. Mehreen Tahir. I'm a GP by background, but I also work as a senior clinical advisor on the International GP Recruitment Programme at NHS England, London. I'm just going to give you a little bit of a background, as Kim said, as to who I am and how I got to be a GP and the work I do, because you'll meet people like me when you first come to the UK and when you start working in a practice. It's quite nice just to know what we've been through and how that might be quite similar or different to the training that you've had. So I did my undergraduate medical training at Imperial College in London. I then went on to do my foundation training. So all medical graduates in England are encouraged to enrol onto a foundation training programme. Normally 2 years. They're known as F1s and F2s, and you will meet them in your practices because some jobs are in general practice. And the purpose of the F1, F2 year, the foundation year 1, year 2 year, is just to introduce you to a number of jobs, the hospitals, primary care, and give you an opportunity to develop and learn as a doctor, but also understand the healthcare system and where we work and work out what you wanted to do. So I did my first F1 year at a large teaching hospital in South London in Tooting. That was St George's Hospital. Had a fantastic year. In those days, not that long ago, but things have changed. We used to do nights and on-calls, and it was a fantastic learning opportunity. So I was really lucky. I had some really good jobs there. I did geriatrics, endocrinology, medical assessment unit, worked in upper GI surgery, and did my first cholecystectomy laparoscopically. And also worked in upper GI surgery, so I had a really good year there. The second year of my foundation year 2 training was in a large district general hospital. Now you'll hear these terms battered around. A district general hospital is usually a bit more rural. It does have learners, so students, but isn't called a teaching hospital. So mine was St Peter's Hospital in Chertsey, and there I worked in A&E in cardiology, and there is also where I did my first GP job. So I worked in a little practice in Chobham West End, and I really enjoyed that, and it motivated me to apply for specialty training. So after you've done your F1, F2, you have the opportunity to then apply for whichever speciality you like. So you can apply for medicine, surgery, there's lots of others, microbiology, radiology, and general practice. So the general practice training is a 3-year programme. They're known as vocational training schemes. So you'll also hear VTS, which stands for vocational training scheme. And these are different schemes based on areas. So what you do is you apply to a region. I applied to London. I wanted to work in London. And then within that, you apply to a VTS. So I applied to Croydon. And there is where I worked for 3 years of my training. So the first 18 months were a variety of jobs which are relevant to GPs, usually in the hospital. So I worked in liaison psychiatry, in trauma and orthopaedics, and obstetrics and gynecology.
Oh.
And then I worked 18 months in general practice. My last year, I was a GP registrar. So a lot of your training practices, or a lot of the practices that you're going into, will have a registrar. And I encourage you to go and speak to them because they have access to lots of different resources and learning opportunities, which I'm sure you'll be more than welcome to. And they can tell you a little bit about how they're practicing, for their exams and what they found helpful settling into general practice. So my GP ST3 year, which is the third year of my training, was at East Croydon Medical Centre. I had a really fantastic supervisor, Dr. Paul Rabinski, who I owe a lot to. Very inspirational, and was a really good supervisor. So he supervised me quite heavily when I first joined the practice, and he gave me the opportunity to learn about all the different roles, all the different people that work in the practice, lots of the community services that I could use for my patients. And as time went on, I became a bit more independent, and he sort of got me ready and got me through my exams, and also ready to be a GP. So then I qualified as a GP. I went on to take up a job in another practice, which was slightly closer to home, which was a 5-session salaried job. Now, you might be wondering what a session is, because we sort of take for granted that you all know that. The BMA website, the British Medical Association website, has a lot of information. But a session is broadly usually about 4 hours, 10 minutes. So I work 5 sessions. That'd be a whole day on a Monday, a whole day on a Tuesday, and a Friday morning. And there I was diabetic lead, which I really enjoyed, and I'll talk a little bit more about later on in the presentation. And I did a lot of women's health. But I was always really interested in making general practice a better place to work, improving the workforce, and how to, different things that we could do to keep young and older GPs in their jobs and keep them happy and well. And that is how I ended up doing the job that I'm doing today. So I work in the International GP Recruitment Programme, as well as on different other workforce projects at NHS England. And I interview people, so I might have interviewed some of you. So first interviews, second interviews, answer lots of questions, provide a lot of support educationally, but also other questions that you might have about insurances and indemnity and all that sort of thing, and really help support your relocation, because we know it's a really big commitment that you're signing up to, and we know it is a big deal, so we want to help you. And that is what I love about this programme. It's so well supported. There's a strong educational component, and there's extensive language support available as well, actually. Yeah. It might be in your country or it might be here, depending on which region you apply to and what your needs are. But it's a really well supported, well-rounded project, a programme for you to enrol on. And it will help you settle into the NHS as a GP and create a career for yourself, which is, what you want to do. There's lots of support. There's a supervisor. And so I really encourage, if you are thinking about being a GP in the UK, in England, look at the website and apply and find out a little bit more.
And we're going to come back to that on the end of the slideshow today. We're going to give you some information about where to get that individual support from, and where to inquire if you want to be part of the programme, because we know that there'll be people who are listening today who are also not quite on the programme, or maybe thinking about joining the programme. We'd really encourage you, and I think the positives are really things like the educational support, really, and the supervision that you have. So that's really good. So that's Mehreen and I. We're going to be doing all of the Skype broadcasts for you over the next sort of few months. So we're going to see lots of you. So a little bit first about a welcome, really, and welcome to the NHS. Both Mehreen and I have worked in the NHS for many years, and we feel very passionate about it and very proud of the NHS. And we also wanted to let you know that the NHS is a very multicultural, eclectic organisation in its own right, really. About 36% of the people who work in the NHS, not just doctors but nurses as well, come from overseas. About 26% international medical graduates, and about 11% are European doctors such as yourself. So we have a huge workforce that reflects very, very many countries across the world. And I think what we wanted to do was start by welcoming you to that NHS family, really, but also saying well done and thank you really for wanting to be part of both the international recruitment programme, but also part of the GP workforce in the UK. You're a really important part of our workforce today. So I think we wanted to say welcome and thank you at the start of our presentation. Today's broadcast, as I said, 1 of 5. We're going to look at the key features of the international GP recruitment process. That's what IGPR stands for. We're going to look a little bit about the structure of the NHS. Now, we know that doctors who come from Europe and actually all across the world really struggle with the structure and how the NHS functions. So really, that's quite a big part of our presentation today. And think about how you're going to fit into that as GPs. I hope Mehreen's already started by saying how enjoyable and rewarding aspects of being a GP are, but we will look at some of the difficulties of being a GP in the UK as we do our presentations. We're going to start thinking about being a patient and how a patient accesses a GP practice in the UK and how that might be different from your home countries. Mehreen and I spend a lot of time talking to doctors from overseas, and we're always struck by how different that actually process is. And the last bit really is to start identify the next steps to prepare for coming to work in the UK. And we'll be giving you some resources that we think will be really useful, not only for our second broadcast, but also for coming to work with us, really. So a few real structural things about today. We're going to be about an hour long. We'd love to hear. So we have a discussion board on the side that you'll be able to see as well, where you can add bits of your conversation, you can ask questions, but we would love to hear where you're from and what countries you represent across the world, across the European countries. So that would be really good. And just to remind everybody that this will be recorded, this presentation, and it will be uploaded onto 14 Fish and the NHS England website. Now, 14 Fish are when you're enroll on the programme, you'll be sent the link to 14 Fish. It's a free resource with some excellent videos and some excellent information, and they're going to host our video, really, and also NHS England will. So after this presentation, you'll be sent a very brief survey with asking you questions about what you thought, the link to this presentation, and also the link to the videos once we've got them uploaded. Just a few structural things. We have to think about what's called the General Data Protection Regulations in the UK. So there is an opportunity if you ask questions, and they will come up on the side. So think about how your name appears. We did send you out some information about that beforehand. So your name will appear on the side for us. And as I said, we're going to upload it and record. It will be recorded, and it will remain on those websites for about 6 months, so quite a long time. So do think about questions, but really, we are really happy. And again, we will be giving you our contact details at the end. So if we don't have a chance to answer your questions, just let us know. If you just want to type in the country that you're coming from, Italy, Spain, fantastic. We would love to hear. I just think it makes it really alive for us and makes it really fascinating. We love to hear about your countries. We also love to visit your countries. Yes. That's really nice. So I think the first part of the programme is going to be literally talking about the programme, really, and Mehreen's going to do that because it's really important about the structure of the programme, isn't it? And how you might fit into that journey. So we're going to just go through a couple of slides looking at that, really.
Sure. So the international GP recruitment is a really exciting opportunity for us to benefit from all the skills and diversity that you as GPs in Europe can bring to the NHS. I've met some of you, and I've just been fascinated by all the skills, the background, the experiences that you all have, and I think we're really lucky to have this opportunity to work with you, so we welcome you to the UK. You might have heard of the 5-year forward view. It sets out some targets at government sort of level, and yes, we're targeting international GPs. We want to recruit 2,000 GPs by 2020, but we want you to come and work with us, but also provide you the support that you need, and we recognise that some of the systems that you work in are actually quite different to the ones that we work in, you might need a bit of support settling in to the NHS, to general practice, because we know that clinically you're all excellent. You're probably very experienced and working as GPs for some time, or been trained as GPs, but there is something slightly different about our NHS and our processes. So this programme really recognises that and provides you the time and support and resources to really settle in and create a career for yourself in the NHS as a GP. So here you'll see a diagram. I should say that all this information is available on the NHS England website. Our last slide does have a link, and I'm just giving you a very broad overview of the processes. Depending on where you apply, it might be slightly different. So talk to your recruitment agencies, use the NHS England website, send in an inquiry form, and so that you get the most accurate information. But I just wanted to give you a bit of an idea of what you might expect if you enrol onto the programme. So the NHS England website, like I mentioned, has an inquiry form, and on that inquiry form you can register. It asks you a few questions and asks you where you might want to apply, and that will be directed to sort of our headquarters. You're then redirected to a recruitment agency. So different regions have different recruitment agencies. You might be at any stage of this process, I should say. You might be already talking to a recruitment agency, you might be thinking about it, you might have had your first interview, your second interview, you might be waiting for placement in a practice, or you might already be working here. So you could be anywhere on this journey. So the recruitment agency will then look at your basic qualifications, your medical qualifications, do some checks that you'd expect to be done when you apply for any job, so police checks, whatnot. There's also a certain requirement, an English requirement, so they can talk to you a bit more about what those are. But I should say, like I said before, there is an extensive language support available in and out of your country, so we're there to help you with language as well. The details from the recruitment agency are then passed over to a regional NHS England team. So depending on where you want to work, the NHS England team will then look at your CV and organise a first interview with you. That first interview is often done over Skype or over a video link, but sometimes you might already be in the country, and I've certainly done interviews face to face. And depending on which region you're applying to, it might be slightly different. But where the region I work for, we try and keep it very informal. So we want to know a bit more about you, about your motivations, about whether the programme is going to be right for you, as well as whether you're going to be right for the programme. And it's just a chance to ask questions and have a bit of discussion. The second interview again varies region per region, but usually is a bit more formal. So it can be a 2 or a 3 day process. We try and encourage you to meet with different practices, so there's a bit of an informal matching up process, but part of the second interview also involves a formal interview, and you have a panel of different people, so usually some from NHS England. There might be a patient representative, there might be an educator from Health Education England, and they'll all ask you similar questions, so probably in the first interview, but in a bit more detail. There's also something else quite special that happens at second interview, which I really like. It's called the Learning Needs Assessment.
It's a great resource.
It is, and it's an opportunity for you to discuss openly with an educator, so a trainer, about your clinical needs. So we ask you all to do the Royal College of General Practice self-test. I've recently started doing it because I think it's a really valuable tool to assess what you don't know. And that actually forms the basis of the discussion at the Learning Needs Assessment.
And that's really just a discussion, isn't it, really? It's not an assessment like an exam, pass or fail. It's really to identify things. We know that doctors from overseas sometimes have gaps where they haven't had the clinical experience, just because that's the way healthcare is organised in their home countries. So women's health might be one example, mightn't it, really? So,
absolutely. So it's just an opportunity to talk. And the purpose of that also is because, you know, we are offering an educational component to this programme, which is quite a big part of the programme. And in the beginning, you'll have some structured sessions of education, most probably, and that might be based on some of the things that came out for learning needs assessment. And also we have lots of resources, so if an educator or your supervisor knows what your learning needs are, they can direct you to the more appropriate resources for your needs. Then after the second interview, you will continue talking to your recruitment agency, but usually what happens is you're matched up to a practice or an organisation, talk about start dates, contracts, and the programme agreement, which is a 3-way agreement between your educator, you, and your NHS England. That's all signed, and your recruitment agency will provide you quite a lot of support with relocating.
Relocation's a real big issue, isn't it, really? And we want doctors to come and feel comfortable working in the UK. So, you know, your recruitment agency will look at things like schooling, where you might want to live, housing. Will help you with lots and lots of those those practical, because those things are really important.
Yeah, and they can be difficult when you're coming in and you don't know the area. So we recognise that, and we recognise the financial burden. So there is financial help with helping you relocate, which is also something great about this programme. So we try to think of you as a whole rather than just as a doctor, and provide educational support, but also all the other things that you'll need support with when you're moving to the UK. Then you start your programme. So again, this does vary region to region, but I'm just telling you broadly how most regions work. You enter an observership period in your practice, so you start working your practice, but the observership period is an opportunity for you to get to know about the local services, how your practice runs, all the different resources available to you, and then you sit some assessments, some tests, called the INR, which stands for Induction and Refresher. And once you've passed those, you enter onto the induction refresher phase of the programme. This is when you're working a little bit more independently, so you might start seeing your own patients, have your own clinics, but you know you've got your supervisor there. So if you need to, he'll be there or she will be there, and there'll be an opportunity to talk to them about how you're getting on. Once you finish the induction refresher component of your programme, you then are entered onto the performance list. So it took me a long time to understand what this was, but my understanding is that it's basically a register for all the GPs that can work in England. So you're entered onto that, and then you're an independent GP like me. You can work independently, but the special thing about this programme is that for the total of 3 years, in total, you will have some educational components of your work plan. So you have some time set aside to learn and develop, which a lot of salary GPs such as me don't get. So I think that's really great about this programme. So it gives you a bit of time to understand what you need, where you want to go, what sort of GP you want to be, develop any special interests, all with the support and the security of working in a practice with your supervisor.
And I think that the really big part of that is that supervision, really, isn't it? And I would say, I know you've mentioned it already, but the regions have different schemes, don't they? So some of the regions might be slightly different. I think we've just looked at the overall scheme, but there might be some slight differences. So I think that's really important for you to be aware of. And also, just alongside that, I obviously work for the General Medical Council as well. So your General Medical Council registration will happen alongside all this process. And again, the recruitment agencies are fantastic at that. So we've got a lovely gentleman here, Nick, who's going to give us a few, because we find it very hard to look at the discussion board as well as speak. So Nick is kindly flashing up a question that somebody's asked that we're going to try and answer now. So Mehreen.
So actually it's a hello. So thank you everybody.
Thank you.
It's really nice and special to know about who you are and where you're from. So Ayaz from Belgium, Manuela from Romania, Flor from Spain, Pfizer from Kenya. Rob from Australia, Kareem from France, Danielle from Australia. Hi everyone, and thank you for joining us. Please fire away any questions that you might have.
That's really nice to know, isn't it, really? Yeah. So the next slide is really an overview of the same process, really, of applying. And I think that's just a time when we wanted to sort of talk really briefly about English language testing, which again, the recruitment agency will help you with and help you through the process. I think they are there to be on this journey with you. They will guide you through that journey, be it relocation, be it support, be it education, be it what you need for your language support. They are there to sort of support you, aren't they, really, until you start the programme with us, really, which is great. And there's a link there on the bottom for how to get all this information, because there's an awful lot of information, I know. So anything else you want to add, Mehreen, to that?
No, I think we've given you a bit of an overview of the programme. Again, it's all on the website, so please have a look.
So we wanted to start a little bit also, because the General Medical Council, this is where Mehreen and I are today. We're in Manchester. We're being hosted by the General Medical Council, and we thought it might be a really good opportunity to talk about how the GMC can support you also during your recruitment journey to the UK. So I want to start with a question, really. So my question is, our primary aim of the GMC is to protect patients or to protect doctors? Now, Mehreen, we have talked about this before, obviously, but I know that you shared with me what you thought.
Yeah, so I've always thought the GMC were there to protect patients, but I know they do more than that.
Yes, so we're there to protect patients, you're quite right. That's our primary function in the law under the Medical Act. But whilst our job is to do that, it's also to support doctors such as yourself through that journey. And as I said, I go and do sessions, and I will meet some of you during your journey in the UK. But I go and do sessions on what we produce on our GMC guidance, and it underpins everything you do as doctors. So it's really important that you are aware of it. And again, we're going to talk a little bit about it through the whole of the Skype broadcast. But just to mention that we write a lot of standards and guidance, which is excellent. The main one in the middle is good medical practice. I've brought the consent guidance along with me today, but some of that is really relevant to you as general practitioners, and we're going to be using that guidance during each of the sessions and during a patient journey that we're going to be talking about. So it's all available, but the really good thing is that you don't have to read it all, because it is all available on our app, and you've downloaded that app.
I've got this app, and it's quite handy because sometimes you can be sitting with a patient and be faced with a bit of a dilemma, or be having a discussion with a colleague at your practice, and actually they're really easy to read, and having it at the touch of your fingers on your phone is just fantastic. So I encourage you all to download the app and just look at different sections when you get a chance.
Yeah, it's free.
Yeah,
so that's a really good
always
thing.
a bonus.
But the search engine's really good on. So if you just type in confidentiality, for example, then it will automatically come up with the paragraphs, and it tells you what to do. So all of your practice is actually based on good medical practice and our standards and guidance. So it's world class information that's really useful for you. But we will come back to the GMC, but we wanted to talk a little bit about our National Health Service. And as I said to you earlier, we know that doctors from overseas really struggle with how it works. And sometimes, to be honest, we find it hard to understand. It is quite complicated. So we're going to talk a little bit about the National Health Service and how it impacts on patients. So we're going to start with Mrs. Thomas. She's going to come in and out of our broadcast throughout our 5 broadcasts. Mrs. Thomas will arrive, and you'll have videos of Mrs. Thomas as well, so it'll be really good. She's 58, she's married. She lives with her son in a semi-detached house on the outskirts of town. So semi-detached means 2 houses joined together. She's just found a breast lump. And she's worried about it, and she wants to make an appointment to see her general practitioner. I'm sure that's the sort of patient that you would see.
So I mean, many Mrs. Thomases.
Yes, many Mrs. Thomases.
In my work, so you'll very soon be able to identify with her.
Yeah, so let's think about Mrs. Thomas. So I first want to talk about the NHS generally, because it was founded in 1948 by a gentleman called Anaya Bevin, who was the health minister. Actually, he came from Wales. He was the health minister of the day, and he identified, he was the son of a coal miner, and he knew that he felt it wasn't fair that healthcare depended on whether you had money or not. So he formed the NHS, and it meets the needs of everybody. It's free, so patients don't pay when they come and see you, do they, Mehreen? And it's based on clinical need, not the ability to pay. So it's a fantastic organisation, and I think if you asked most people who are walking the streets today, if you ask them what they were proud of, they would say the National Health Service. And last year, actually, it was the 70 years of the NHS, which was pretty amazing. We had lots of celebrations, lots of parties, we all felt very, very even more proud of the National Health Service. So 70 years of the NHS last year, which is fantastic. So funding of the National Health Service, it is quite complicated, but it starts really, although we tend to think it's free, it actually isn't free, because we pay for the NHS through our salary. Both employees and employers pay for the funding of the National Health Service. And that money is actually sent through Parliament to the Department of Health. And it eventually comes down through something called clinical commissioning groups, which we will again talk about later, to the general practice. So your practice, I know, has a lump sum of money that comes down from the government, but actually comes from Mrs. Thomas. And it actually comes from Mrs. Thomas's salary, and it comes to care for patients like Mrs. Thomas. So let's look at Mrs. Thomas again. Mrs. Thomas she works at a university. You're going to find a lot more about that later as well. She earns a salary of £24,000 a year, and her monthly national insurance bill, so this is not taxation, so taxation is another part of things that come out of our salary, but our national insurance is paid by our employer straight from our salary, and she pays monthly £145.76 from her salary to pay for the National Health Service. And as I said, it's taken straight out of her salary. She has nothing to do with that, alongside taxation. So that's actually how she pays. So we thought we'd think about, and it's quite complicated again, but how does Mehreen's GP practice get the money to care for Mrs. Thomas? So how does that money come down, and how does that money arrive in your payslip, really, and in the practice's payslip to actually fund that general practice that we're going to look at later?
So you said, Kim, it is very complex, and I'm going to give you a very, very simplified version of it.
I'm going to flip onto that slide.
Yeah, so I'm going to simplify it hugely, but I'm just going to talk about the 3 main funding streams that lead to payment for Mrs. Thomas. Thomas. And one of the first things to say, because I know this is different to some of the doctors in Europe, the money for Mrs. Thomas never comes to me as a GP. It goes to the practice. And the practice pay me a salary. It might be different if you're a partner, but it never comes to individuals, it comes to a practice. So the three main funding streams that I'm going to talk about are Global Sum, Quality Outcome Framework, and Enhanced Services. And I'd encourage you, when you do get into your practice, to go and speak to your practice manager or your supervisor, because they'll be able to tell you a little bit more about how it works in that practice, and they'll be able to tell you about a few of the other funding streams that I've sort of left out as well. So all these three funding streams arose out of the GP contract, which was negotiated and introduced in April 2004. And this is after it was recognised that there was a huge recruitment problem and low morale, not enough GPs, and so we needed a pay increase. And there was a lot of negotiation between the Prime Minister's office and the Treasury. And what it set out to do, this new contract, was to allocate resources according to workload.
Yes.
So it wouldn't mean that if your practice had a higher number of registered patients, you would get a higher amount. There were some very clever ways of working out what the workload in that practice were, and you'd be paid accordingly. And I'll explain how we do that in a minute. But the GP contract was really great. It had lots of benefits. It gave GP practices a lot of flexibility, a lot of autonomy, and the chance to run services how they wanted to, because the bottom line is they knew their local community. Yeah. They knew what the community needed, and they could put on services and have the authority really to do that under this new contract. So I'm going to talk to you about GMS contracts, which we will hear about when you're at work. Most practices you're going to be in are likely to be GMS contracts, but there are other versions of the contract.
General medical services.
General medical services, that's right. It. So there are PMS and APMS, but I'm just going to ignore them for the purposes of this broadcast. So general medical services, this is a contract which is agreed between your practice and NHS England for delivering care to your local community. And in that contract, we cover these three areas. Right. So I'll start with Global Sum. Global Sum makes up about 50% of the payment for Mrs. Thomas's care, roughly. It uses a really special formula, which I was taught at med school, but never really understood until I became a GP. It's called the Cahill formula. It's quite interesting. I would encourage you to go and Google it. So Cahill. And what it does is it uses things like age, morbidity, so how sick people are, mortality, how many people die in your local area, how many nursing home and residential home patients you've got, because they might need more visits. It looks at staff costs locally. So actually a receptionist might need to be, is a receptionist in London might be paid more than, say, rurally, or it might be the other way around, I don't actually know. But it also looks at list turnover. So where I work in Wimbledon, we have quite a high list turnover. List turnover means how many people are registering and leaving the practice.
Is that because you're sort of commuter belt?
Yeah. So that's why. Yeah. And you think actually that you'd get less money if you've got a higher list turnover because you're losing patients, but that's not the case, because it's thought that new patients need more services than someone that's been registered at your practice for quite a while. So the Cahill formula is really special actually, because it takes into account all those different things, and it comes up with a sort of assessment of the practice's workload. So just to give you an idea, for one patient for 1 year, on average, in 2016 and 17, the global sum payment was £80.59. What do you think about that, Kim?
Well, it's difficult, isn't it? Because somebody like Mrs. Thomas probably hasn't seen her GP for a while. I'm making an assumption here. Yes, she's seeing a GP now, but she hadn't beforehand. So actually £80 for one visit. But obviously some of the patients who you might see also who have very complex comorbidities, they're going to see you every month. Yeah. So that isn't a lot of money. So it's all balancing, I presume, and that's taken into account in this Cahill formula, which is really sensible.
It is. And remember, the visit to the practice might not just be to see a GP, it might be a practice nurse or for something else. So this payment encompasses all of that.
Right.
So that is a global sum. The next stream of payment is Quality Outcome Framework, so known as QOF in primary care. So if you're already in practice, you will have heard about QOF. QOF is made up of 559 points. and it's actually one of the biggest pay for performance tools in the world. So it's driven. The purpose of QoF was to standardise care, to use increased use of clinical IT systems, and to diversify practice teams. But what it actually is evidence-based interventions, which we know benefit patients. So, for example, I'm diabetic lead, as I mentioned, in my practice. So I'm responsible for looking after the diabetes QoF. And in the diabetes QoF, there are things like trying to get someone's blood pressure to a reasonable level, checking that their blood sugar levels through their HbA1c is well controlled, making sure they've had their annual eye test, making sure their urine's been checked for leaky proteins, making sure that they've had a kidney blood test. And all of those things actually would benefit the patient. And it encouraged us actually to reach out to those patients that we might not actually see. So, for example, just a couple of weeks ago in my practice, I saw that actually we haven't been so good at getting diabetic patients to check their urine. So I asked the healthcare assistant if she would mind doing a bit of a search and sending out test pots and a little letter and a request form to those patients and asking them to drop that off at the practice for testing. And I imagine that we might pick up a few people who actually have a kidney problem, whose diabetes need better controlling. So it's a way for us to reach out and really help those patients who need. Like I said, there's lots of different QoFs. There's ones for dementia, depression, women's health, and these QoFs are changing. So only very recently, actually, there was the first review of QoF since it was introduced in 2004. Right. And that was sort of looking and recognising that actually long-term conditions, the prevalence it is much higher. So actually we needed to change our QoFs, and also recognising that some QoFs were becoming a bit of a tick box exercise, and that's not what they're there for. So all of that is under review. But like I said, I'd go and speak to your supervisor and your practice manager, who will be very happy to talk you through QoF and how you can help. I actually find it quite rewarding. So when I go into my practice, on our IT system, we use EMIS. So there are 3 main IT systems in England. EMIS might be one of them. And we have a little tab called population reporting. So I've become a little bit obsessed by clicking on that tab and looking at where we are with our scores. But it actually improves patient care. So there is a wider purpose for it. So what happens is we recognise that most practices, in fact, I've never seen a practice achieve 100%, but the likely number of points going to be achieved is agreed with the local commissioning group. The practice is then given a monthly payment of 70% of that, and then at year end on the 31st of March, which is a really busy and stressful time in most practices, the actual achieved QoF points are sort of reimbursed. And again, to give you some sort of context, one QoF point is worth in 2018 and 19 was worth £179.26p. But go and speak to your practice manager. Go and have a look at the QoFs in your practice.
And just to say, the practice manager is such an important person in practice, isn't it? Really, it's really a person to spend a morning with. Really,
absolutely.
Going through how the practice works as a business, how it functions, everything about the practice.
So I've learned so much from my practice manager. I'm always badgering her, and they quite like being asked about what they're doing. Absolutely. So I'd encourage you to go and do that. Then the last stream of payment are enhanced services. So these are additional services that a practice can choose to provide. They're commissioned nationally or locally, depending on the population need. And you will hear 2 terms when you're in practice. One is DES and one is LES. So DES stands for Direct Enhanced Service. So like I said, the practice is not contractually obliged to provide this service, but most do. Includes things like flu vaccine.
All right, yes, very important. Yeah.
And in the CCG I work in Mehreen, we have a DES for extended hours. So we do out of hour clinics, and that's something that all the practices in our region do. A LES varies according to which area you're in.
There's a
locally enhanced service. So that's negotiated very locally. So, for example, in my CCG, there's a LES for warfarin monitoring. So we do some of the warfarin monitoring in the practice rather than send patients to the anticoagulant clinic at the local hospital. But again, these are all changing, and I have a feeling that LES might disappear as now more patients are not taking warfarin and actually using some of the new NOACs, which some of you might have heard about. So those are the main three funding
Yeah.
streams. Like I said, there's lots of more. There's premises payments, all sorts of other things, but beyond me and beyond this discussion. So go and spend some time with your practice manager and find out more about it. Or have a look at the NHS website. Actually, there's a lot of information on there.
And I think that's made it as simple as possible, hasn't it, Mehreen?
I'd hope
It is quite complicated.
I'd hope
but that's great. So that's how the money comes to general practice to look after Mrs. Thomas, and that's what we wanted you to think about. So every patient that comes through the door, they have these complicated formulas, but they're worked out to make the best services for them, really, and to meet their needs, really. So the next thing we wanted to do is, oops, my slide won't click on. Let's just think about that in a second. Just one technical hitch is typical, isn't it? Technical hitches. One thing we wanted to show you, really, we did some filming recently at a medical centre, a practice in Manchester called Manchester Medical. And we wanted to say to you that when you come for your interviews, and one of the things that you will do is go and visit your practices, visit the practices that have spaces for doctors such as yourself. And one of the first things you can do is have a look at their website and see what's available. And Mrs. Thomas, she will go to the website, she'll have a look, and she clicks on reception and inquiries, and it tells her how to make an appointment. So we thought we'd look at how Mrs. Thomas actually accesses that GP practice that Mehreen's talking about, and how she actually makes an appointment and how she actually walks in through the door. So thinking about from her perspective, really.
I think there's a lot of value actually in looking at your practice website, because it tells you a lot about all the different clinics that they run and how the practice runs, when opening times are the doctors. So when you're looking at GP practices, that's a really good thing to do, is go and look at their website.
Yeah, I think it gives you a real feel for what's going on. It even has the pictures of the doctors, doesn't it? So you can actually have a look at them. I think it was useful for us to mention also that GP practice is just one part of the healthcare community or health service in the UK, and there's a big push at the moment to pushing or asking patients to go to local pharmacies to think about how they might care for themselves at home. There's an NHS 111 service that we'll talk about later, or there is dialing 999, which is our acute ambulance service. But I know that a big part of your role is actually signposting patients to other services, isn't it?
Absolutely. So I do that a lot. Yeah. So people who come in with sexual health problems, there's a gum clinic, genitourinary medicine, which is sort of walk-in. You don't need to see a GP for, so you don't need to get an appointment or wait to tell me about your problems. You can actually go there and get really good treatment. There's early pregnancy unit for women who are pregnant, who often have problems, who have a walk-in system, so you can just walk into those. But it's also about educating patients. So actually, when you see a patient who's had a fever for one day, has a sore throat, is usually generally well, it's about telling them actually that you can do things at home, that it doesn't always have to be medicine. So I always, honey and lemon is my favourite. I've got the whole of Merton with honey and lemon drinks. So it's just using that opportunity in your GP consultation just to educate the patient about where they should go and what they can do for themselves.
It's almost, I suppose, the last thing you do before you walk out the door is to say, next time you have something that might be useful. I think that's really important. And so the local pharmacy, is something we're going to come on to later, isn't it? We're going to actually show you the pharmacy and show you how that functions. Sorry, Mehreen.
No, and I was just going to say the 111 service is something that we will talk about later as well, because it is really important for you all to know what they can do. Patients don't know, but I've actually been surprised by the number of doctors who don't know what 111 can offer. So we'll touch on that later.
We will. So the GP practice is just one way of entering into healthcare, really. And for Mrs. Thomas, there are two main ways of getting an appointment: booking one online or coming in to see your receptionist to book one in person. But also a lot of people phone up and make an appointment. So what we thought we'd do is think about, how does she access her general practitioner? Her general practitioner, who you're going to meet later, is called Dr. Kalowski, and she is somebody that we will meet in the next Skype broadcast. So we're going to show you a quick video of how Mrs. Thomas actually accesses her GP. Now, due to issues with broadband, you all dialing in from amazing countries like Australia and across Europe, there is no way that we can have consistent broadband to show you the video on our screen. So one of the best ways to do it is, I've got a fantastic colleague here, Alexia, who has been adding you to our broadcast today, who's going to send you, or has, I know, just sent you the link for the video. So if you actually copy that into your web browser, we also sent it to you beforehand as well, so you might actually have looked at it beforehand, which is fantastic. You might need to take that those little stars off at the beginning, but if you do that, we're just going to pause for a minute and 20 seconds to let you watch that video. So I'm going to just do that now. So brilliant. So I know that for a few of you can see on your, we're looking at the conversation, a few of you are struggling with the link. So I do apologise. We're going to look into that again for the next broadcast. But, you know, technology, it's not perfect, but it tries its best. So I hope that you saw that. And I hope that you saw how she actually booked an appointment with the with the GP receptionist. Now, GP receptionists are amazing people. And my mum was a GP receptionist. So, you know, they are the link into the general practice, into your surgery, and I think they're fantastic. So that's one way that Mrs. Thomas can actually book that appointment with her GP. So when she getting a GP appointment can be complex. It's one of the things that we are very concerned about, and there are lots of different methods for getting an appointment, aren't there, Mehreen? So you know, putting yourself in Mrs. Thomas's shoes.
Yeah. I think it's really important actually to understand what Mrs. Thomas might have been through, because obviously there are different tensions and there's certain limited resources. So understanding which appointment she's got and how she's got it is actually quite important. Every GP practice works very differently. The few that I've worked in have worked completely differently as well. So go and speak to your reception manager or the receptionist, find out what all the different options that patients have. Normally, the patients can register for online access, and they can book appointments. They can choose which doctor, which day, pick which time, and book their appointment that way. They can do other things with that online access, I should say. They can request repeat prescriptions and things as well. So that's something to look into when you start in your practice. You can, of course, phone up like Mrs. Thomas did and get an appointment. But there are different appointment systems at each general practice. So, for example, in my practice, we don't pre-book any children's appointments. So we have a certain number of appointments blocked off with each doctor for children. And we ask all children's parents to call up in the morning or come to the surgery in the morning. And we guarantee that they will be seen that day. So whether it's urgent or a long-standing problem, they're all the same appointments. There's usually urgent appointments, which are what you'll hear them called on-the-day appointments. There's routine appointments, but there's also different types of appointments. So I fit implants and coils, and I need a healthcare assistant with me when I do that, and I need longer, and I need to have spoken to the patient before. So there's special appointments which appear as different colours usually on your system, say a women's health appointment, or there might be a baby check before they have your immunisation. So just have a look at what sort of appointments that you've been given, and talk to your supervisor about those different types of appointments, because it will obviously prepare you a little bit before the patient walks in. The other thing to say is that there's different hours cover for different practices. So like I said, my practices, we do extended hours. So we have a doctor on the premises till 8 o'clock, and we don't just use those for emergencies. We do use them, recognising them as commuters. We use them for routine appointments as well. After that, we would ask patients to call 111. And when they call 111, they get put through to a trained triager, so someone who will ask them a few more questions, who then directs their call to different avenues. And one of those is for a telephone consultation with a GP. So on a Saturday, that's often what I do. So I speak to people over the phone and talk to them about what their problems are. And sometimes, you know, they can be reassured on the phone and don't need to see someone. Sometimes they can go to a pharmacy. Sometimes they can go to another clinic like the GUM or the early pregnancy unit I talked about. And sometimes they do need to see a doctor. And we do have appointments on the weekend and in the middle of the night, out of hours with a GP. So you can book them in with them as well. The other really interesting thing is some practices are being quite innovative and looking at the problems that they have and how they can work best to solve them. And one practice which I know of every single patient who calls up for an appointment has a telephone appointment first. So I think it's called GP first. When you speak to the GP first, they will try and sort out your problem over the phone or see if it's appropriate for you, and if so, we'll book you in to see someone that day. I've also know of other practices who are using video consultations, so that's something that I think is probably going to be taking off. And of course, there's a face-to-face appointment. The other thing to say, face-to-face appointments, you don't always have to see your GP. So as part of my other role in NHS England is to improve the workforce, use lots of new roles. So some practices have paramedics. We have a clinical pharmacist in my practice. The clinical pharmacist does a lot of things that I used to do. So titrating people's blood pressure medication, you know, getting them onto the right medication after they've been discharged from hospital, for example. Something else that I'm working on is getting more physicians associates. So you might come across these when you work, these people when you work in your GP practice. And they're basically trained professionals that can do a lot of things that the GP again spends time doing, and that just frees the GP up to do more complex work, which is great.
Yeah.
And I talked about all the different clinics. There's baby clinics, diabetic clinics, again run by GPs, nurses, health professionals. Sometimes you have visiting consultants come in and do certain clinics in your practice. So go and speak to your practice manager, go and speak to your supervisor. And in that observership period, I would encourage you to try and sit in with some of these. I sat in a lot with the diabetic nurse and the COPD and asthma nurse, and I found it really helpful to understand what they're telling the patient, and also what the patient's concerns are, because they sometimes have a bit longer, so the patients sort of talk more freely. So go and do that when you arrive.
I think it's interesting. So we've had a question, I know, about the average day of a GP. It sounds to me, while you're talking, there isn't an average day of a GP, because it depends what hours you work, depends whether you're covering the out of hours service or the early morning clinic, or there isn't an average day, is there really?
There isn't really an average day. No. Again, depends what practice you're in. Usually you have a combination of on the day appointments, routine appointments. You might be asked in between your morning and afternoon, or morning and evening clinic, to go and see somebody who's housebound, who needs a home visit,
or in a care home,
or in a care home. You might do so. In my practice, we do ward rounds for certain nursing homes, but it varies so much. So
that's the joy of it, really.
Exactly.
Exactly.
Another practice, we used to all stop at 11 o'clock and have a tea break and discuss clinical cases, which I used to love and was really valuable. So it will depend on where you are and what you're doing.
Okay, so it's a complicated, and I think it's important to recognise that Mrs. Thomas has had a complicated journey even getting to her GP, and that creates a lot of anxiety in itself, really. So imagine how she might feel even before she gets to you, really, judging what you said. She's got a breast lump, she's going to be worried, scared, anxious, she's thinking about, is it cancer? Even down to the fact that will the GP feel the breast lump? Is it just me imagining it? And even thinking, do I need to tell my family about this yet? I'm really quite concerned. So let's have a look at when she arrives at the medical centre. Again, I'm going to ask the lovely Alexio to send you a link to actually just try and watch the video. Again, you might have done that before. Mrs. Thomas actually walking into the practice. So we're going to be thinking about that now. Okay, so brilliant. So I'm hoping you're accessing these videos. I hope you enjoy them. They are available afterwards. As I said, you've been sent the links on YouTube. They will continue to be there for you to have a look at, and just have a look round, just see what it actually looks like, a GP practice. Now, this is only one, but it's just useful for you to think about. So back to Mrs. Thomas. She's now got her appointment. She's worried about her breast lump, and she's chosen to visit Dr. Klowski. Dr. Klowski has cared for her family before. So thinking about her cancer journey in the UK, we need to be thinking about this ready for our next broadcast, don't we, Mehreen? So, but before I do that, I'm just going to take a couple of questions, because there have been a couple of questions while we've been sort of looking at the videos. One question about, I know Christina says hello. She's a Spanish GP. She's preparing for her OET exam. What I would say is OET and IELTS are English language tests that we recognise. And what I would say is that there's a stack of information on our website, and you want to know how to prepare for it. The recruitment agencies, again, are experts in that, and they will help you along that journey. I think, there are things like watching television, reading the papers. Depends if you're in the UK, you can read a UK paper, but simple things like that are really, really useful. But I know the recruitment agencies are experts on English language testing, so I'd certainly recommend that you do that. The other thing to say is this programme, the International GP programme, is actually at the moment only for EEA doctors, isn't it?
And
Australian doctors, sorry, apologies. But there is a lot of information on our website, also on the NHS. England website, because I know that Gavin's phoned in from Guyana about how to access and how to join the NHS from other countries as well. Certainly on the GMC website, and we will make sure that we send some links out. There is information about how to register on our General Medical Council website if you are an international medical doctor, not just an EEA doctor. Sorry, yes, Australia as well, Mehreen. So I think that's just another question. We'll come to another question in a minute, but just to mention that cancer, like all across countries all across the world, is a very common condition that I know you will see lots of patients for, like Mrs. Thomas. And in the UK, the most four common types of cancer are breast, lung, prostate and bowel cancer. So that's what Mrs. Thomas is going to be worried about. Yeah. So I think that's important that we recognise that. We are going to look at cancer a lot in the next scenario. Yes. And what Mehreen and I wanted to point out to you on the next slide is some really important resources to look at for the next broadcast. I know the first one is about cancer waiting times. Now, NHS England define how long you have to wait if you have a suspected cancer, don't they, Mehreen? So
there is quite a robust system in general practice for suspected cancers. Obviously, there is a set out criteria, all again evidence-based for different types of cancers. But if you go and see your GP and you fit some of those criteria, or the GP is worried about cancer, they can refer you on the 2-week rule cancer pathway, and that's national. So every GP practice has access to that. And lots of surgeries have really robust systems in place. So my surgery, we email the referral. We then fax it, and then somebody's responsible for an acknowledgement, and there's a 2-week rule referral team who check that that's happened and you've got your appointment. It's very important, but it's important also to tell patients actually that you should hear from the hospital within 14 days, and to let you know if not. But we can talk about that a bit more in our next broadcast.
And the other thing we're going to talk a lot more about, but again a really fundamental part of GP practice and actually all practice in the UK, is the National Institute for Health and Care Excellence. We call it NICE. So we've asked if you would look before the next session at the early and locally advanced breast cancer pathway, really, and the stage through that journey. So I'm going to hope that you'll do that before the next broadcast. And there's some other also stuff that we sort of referred to a bit during the broadcast. There are a couple of apps that you can download. We talked about Good Medical Practice app, but also My Continuing Professional Development, My CPD, is another free app from the General Medical Council. There's also stacks of stuff on the GMC website on good medical practice, lots of case scenarios, over 60 case scenarios using the GMC guidance. And there's also, a bit like your learning needs assessment, there's also an online self-assessment tool on the GMC, and those are the links. We will send you around the presentation, but the links are in the presentation for all those. We've got stacks of learning materials. I think the King's Fund video on how the NHS works is excellent. It's about 6 minutes long. But
things have slightly changed, but it gives you a good overview of how the NHS is structured.
I love that video. I could, watch it, and it's really, really easy to watch. So I think that's really nice. And we'd love you to have a look around some of these resources before the next broadcast. So save the date for the next broadcast, really. It's Wednesday the 27th of March, same time, and it's called The GP as the First Point of Contact in the NHS. And we'll see a lot more of Mrs. Thomas and how she interacts with Dr. Kalowski. But between times, we will send you some emails via Alexio to not only evaluate today, but also just to talk through some of the things that you can do between now and then. We would like you to write on the discussion board if there are any other ideas for broadcasts we'd like in the future. And finally, I know we're going to answer a few more questions, but if you are interested in applying, Mehreen's talked about this a lot. There's some fantastic stuff on the NHS England website. There's a couple of questions. So Gavin says, what should I do after passing PLAB 1 and 2 and completing my registration with the GMC? Well done, Gavin. Fantastic. Was Gavin from Guyana?
He was.
He was from Guyana. So, Gavin, if you want to email, I'm going to click onto the next slide, but I'll click back. But on the next slide is, if you want to just take a picture of both these slides, really, Mehreen and I's emails, as well as the NHS England website. But Gavin, if you want to email me, I will certainly tell you the process. The GMC have a fantastic contact centre. So if you've passed PLAB 1 and 2 and said congratulations, phone our contact centre if you're worried about any aspects of your registration. But again, if you want some careers advice about what to do next and how to apply for jobs, the NHS Jobs website is really, really good as well. So the NHS Jobs website. And
the next question was from Dr. Pfizer, which was, is it possible to work as a GP for a couple of years and then become a general surgeon? The answer to that is yes. So to become a general surgeon, you would have to go through specialty training. And from off the top of my head, I think the training is at least 5 or 6 years before you become a consultant. But the thing to say is, one of the beauties of general practice is that you can develop special interests. So like I mentioned, I have a special interest in obstetrics and gynecology. So that's what my BSc was in. And then I did some training after that to allow me to have a bit more of a qualification really, as well as experience to deal with difficult gynecological problems and obstetric problems. And I insert coils and implants, and that keeps me really happy, and that keeps my interest at bay. And equally in general surgery, if you're interested in surgery and you like general practice, you can train to do minor surgery, joint injections, and practices love that sort of thing. It might be one of your leses or your deses that we were talking about, so we'll generate some income for the practice. So by all means, yes, you could go and train as a general practice, but I'd hope you love general practice so much by the time you've had the chance to really embed and become part of our family, if you like, that you won't leave, and you'll be able to develop your special interests within your job.
Yeah. So the two most important slides probably at the end are, if you're interested in applying, then that's how you do it. And the next slide is Mehreen and I's email. We'd be really happy. We haven't been able to answer everybody's questions, but we are going to hold those questions. And if you could email us some of them, we're very happy to answer them individually, and that's not a problem at all. Or also remember the recruitment agencies on not only NHS England website, but also once you've got onto that recruitment agency journey, they are a fantastic source of information and knowledge, and they will answer every single query for you. So I think we want to sort of wind up now, because we've overstayed our welcome with you for a couple of minutes. But you will receive an email from us probably later on this week, beginning of next week, with both an evaluation of today, asking you what else you want us to do broadcasts on, because we want to respond to your needs really, and also giving you some of the links to the presentation, and also sort of the recording of the presentation, so you'll have that and you can sadly listen to us again. Okay, but well done, and thank you very much for listening, and really enjoyed meeting you. Thank you.
All the best. Bye.
All the best. Bye.